This is the side lying release. This is a great activity to do if mom's hips are sore at night. It's also an amazing activity to do in preparation for birth because it brings both sides of her pelvis together to make a nice hammock for baby. What you're going to do is you're going to take your bottom hand and put it right on top of her hip. You're going to back up with your top hand right on top of that one. What you're going to look for is to make sure that her head, shoulder, hip, knees, and feet are all aligned, just like you could put a big box behind her. And then you're going to have her bring her top leg up, forward, and let it drop right over the table. You're going to use pressure in there that's going to be a 3 or 4 out of 10. So you don't need to push down too hard. Just make sure she's firm so she's not rolling. Her belly is going to be nice and close to you so she feels supported. And what you're going to do is either count 10 of her breaths, or you can look down here at her foot and see the fascia in her hip and her body and her leg begin to finally relax. Once she's finished with the side lying release, you're going to have her bring her leg back up together, and then you'll bring your hands off, and then you'll be finished and you can help her up. There's a modification to the side lying release to help out with the rib cage or shoulder tightness as well. For this one, what you'll do is you'll take your top hand and you'll put it right at the crest of her hip. Your bottom hand is going to be underneath her rib cage or her shoulder blade. You'll ask her to bring her arm up over her head, and then you're going to press across this way to traction open the fascia of the latissimus dorsi or the shoulder. Again, you'll have her bring her leg up, forward, let it drop right down, and keep everything as nice and straight as you can. This is an excellent release if she's having a lot of problems breathing because her diaphragm's getting tight. You can slide your hand up into the triangle of her shoulder blade by using the thumb and index finger portion of your hand, and that'll give her a nice, deep, releasing stretch. When you can feel her body relaxed, you'll ask her, and this is important, to bring her leg up first, together, and then you release her shoulder. Then you're finished with the modification to the side lying release. A special tip for partners. One of the things that happens with the mom's pelvis is that it will tip forward when she brings her leg forward. So you can help undo that twist by adding in a little torque with your thumb pointing up that way towards her nose, and then you can back up your hand. At that point in time, you'll add in your compression, 3 or 4 out of 10. Continue as you normally would, and then when you're finished, make sure you go to the other side. You want to do both sides for the side lying release, usually starting with her left side up and then her right side up, so gravity allows baby to nestle in on that left side in preparation for birth.